This is a Fox News alert. I'm Bret Baier in Washington. More Americans than ever are opposed to the president's health care overhaul. Wall Street is circling its financial wagons, and now there is new concern over another major problem involving Obamacare. First, the worst polling yet for the plan. 59% in our new Fox poll oppose it. Just 36% favor it. Those are both records. Also today, Moody's credit agency downgraded its outlook for health insurers from stable to negative based on what it called the ongoing unstable and evolving environment. There's also word tonight Obamacare patients and their families could end up paying for coverage they did not use, even from beyond the grave. Correspondent Dan Springer has the details from Seattle.
56-year-old Tom Giulianella was shocked to find out he qualified for Medicaid under Obamacare. He was able to retire early years ago, owns his home outright in this pricey Seattle area neighborhood, and is living off his investments. He wanted no part of the government's so-called free health care.
I did not want to be on Medicaid because it's supposed to be a safety net program. It's not supposed to be for somebody who has assets that can pay the bill. I used to pay the bill. I didn't want money from the government for that.
After reading the fine print, Giulianella had another reason to flee Medicaid, the potential death debt. States are allowed to recover the cost of care after death by seizing assets. It's been the law since 1993, when states were going broke over rising Medicaid expenses. But under Obamacare, Medicaid eligibility has expanded. The asset test was thrown out, allowing millions more to qualify. But like Giulianella, others want out. The Seattle Times reported on a couple in their early 60s who got married so their combined income bumped them out of Medicaid into the exchange. One wanted to be able to will her home to her children free and clear. The story prompted the state of Washington to make an emergency rule saying it could only recover the cost of nursing home care.
So we have this population that we want to make sure they have access to health care, that they can get in, that they can get the kind of services that keep them healthy.
But most states are not lowering the amount they can collect. A decade ago, California took more than $44 million through a state recovery, a number that figures to skyrocket with upwards of 2 million more Medicaid recipients by next year. Critics see a money grab.
I think that people are maybe in for a shock when they find out that their heirs are going to be paying for care that they didn't even use because they got into a system under false pretenses.
The state recovery is made more complex by the fact collection varies so widely from state to state. The whole issue is so under the radar, interest groups like AARP are still studying it to see how under Obamacare seniors will be affected. Bret?
Dan Springer in Seattle tonight. Dan, thank you.